recruitment, our plan was to recruit 1,200 health workers. Following the Minister of Public Service lifting the ban on recruitment, after the Auditor General had completed the audit process of the payroll, in February this year, we received the submissions following that letter in February from these institutions to recruit health workers. And we're likely to recruit up and above the 1,200 target. So what was our plan then for recruiting these health workers? Specifically, in recruiting these health workers, we used several avenues. One, before February, we were recruiting on replacement basis. And those are health workers who reached their mandatory retirement age. Some health workers passed on, some left. And that was one method, recruitment on replacement basis. That one did not need any clearance from Ministry of Public Service. We also carried out advertisements, and so far we have carried out 5 adverts in the media. These adverts attracted applicants, some who are joining public service for the first time, others for promotional jobs. We also had recruitment based on validation lists. Entebbe Regional Referral Hospital, Kayunga and Yumbe were recently upgraded from general hospitals to regional referral hospitals. So we had to validate the staff in being moved from the districts, that's Wakiso, Kayunga and Yumbe, who were working in those general hospitals to regional referral hospitals. So during that process, we also identified staff that deserved to be promoted. So those lists were already existing, and we had to appoint staff from those lists.